on this episode of The Natural Plastic Surgeon.
That's the thing is with modeling, they don't mind you being fake, but you have to pretend that you got there. You have to basically convince the people that it's natural.
Right.
There is nothing that makes me dislike a celebrity quicker than when they have claimed to never have done Botox or done any of these things. It's like, you're 6 years old. We can tell that you have, and there's nothing wrong with it. You're not any less beautiful just because you have bought some sort of procedure.
We have one of my favorite patients here, Anna Katharina, and she is an Instagram model. She is a spokesperson for Bang.
Yes, that's true.
Yes. You also have your own podcast as well.
True Crime Podcast.
True Crime Podcast. And I want to get into that a little bit. You're also, you're into fashion. You're also a swimsuit model as well.
Correct.
You have
fitness, swim.
Right. Which, when it comes to breast surgery and so forth, I could see that. I mean, we're going to get into that too, that like why that's such a big deal. And,
Absolutely.
And why, you had an original breast augmentation that didn't go well.
No.
Right? And not only like, okay, this is me personally, how I feel, but professionally, that kind of impacts a lot of different things that you could do.
Oh, yeah. If you don't look as good as you possibly can, someone else is going to book that job.
Right.
So I know that I had to get that fixed immediately.
Yeah.
And it basically, the doctor listened to me too much in basically my desired result versus what was best for me. So I wanted it big. I wanted them to be high profile.
Okay.
And he delivered. And I originally liked the result, but then, after a year or so, they bottomed out.
Yeah. Okay. Well, here I want to dive into that, but let's talk about your podcast really quick first, because I want to tease everybody to get to wait to the end so we can talk about the meat of this, which is the plastic surgery experience, and then what we did to actually correct some of the stuff that was going on for you. Tell us about your podcast. Or is it your podcast, or you're just on the podcast?
So I am a co-host for a podcast called Crime Bar.
Okay.
My best friend and I started it.
Okay.
I got really into abnormal psychology when I was a sophomore in college. I think a lot of it was preventative. It's kind of a morbid interest when you're a female, you're in your 20s, and you're basically a target demographic for a lot of crime.
Okay.
And a lot of things were happening on the campus when I went to school at that time. And I figure, the more I educate myself, the more I can protect myself.
Yeah.
And then that kind of I became obsessed with abnormal psychology. It was something I, to this day, wish I had majored in, and maybe later on in life I'll segue into that instead of modeling.
Okay.
But crime, basically the podcast that I'm doing is my way of being able to psychoanalyze and discuss those things without having to go through extensive amount of school.
Okay. What's the podcast name, if people can?
Crime Bar.
Crime Bar.
Yeah.
Okay, cool. So you guys check out Crime Bar.
Yeah.
It's just like the psychology of this kind of what people can actually do. It's just fascinating.
Yeah.
It's just like, you think people are just like you, but there's a lot of people with really different upbringings and different processes going on in their minds.
Yeah, and we all want to think that we're not capable of those things. And then when you dive back into childhood trauma and things like that, you're able to see that it was more a matter of environment and circumstance than even, you're not that far off from a lot of these people, unfortunately. Yeah. So I think that is a big focus for me, is finding where all of this stemmed from, what happened early on in the manner of like preventative psychology and things like that, and therapy.
Cool. Yeah. One of my favorite classes in medical school was psychiatry, and I did really well on it. And it's kind of funny because I'm a plastic surgeon, right?
Yeah.
So it's like half of plastic surgery is actually like psychiatry, psychology.
Absolutely.
So it's just like dealing with people's mental images of themselves, and trying to figure out if this is body dysmorphia, or like, all right, this is a real concern that someone's having.
Absolutely.
So, all right. So how old were you when? Let's talk about your first operation.
Yeah.
And then what was this pressure? People talk about breast augmentation all the time, and people criticize it, like, oh, you should be happy with your body, and so forth, and all this stuff. And I hear both sides of everything. And I personally think that people want to make changes to their body in a safe and respectable manner. I think that it totally makes sense. It's your body. Life is short. Do what you want to do. Do what makes you feel good about yourself. And I see it, the power of that decision. I see it in all my patients. I saw it in you. I see it in my patients when they come in 6 weeks later, and they're just like, thank you so much. I feel so much better in my body, and their confidence just goes through the roof.
Absolutely.
Even though it might even be just a small thing, right? And like, how could this possibly be holding somebody back? But it's just incredible. It's very powerful, and that's why I love what I do. So tell us your story back. Like, I guess, how did you get into modeling? Did breast augmentation come first, or like what happened? Yeah. Tell us about all that.
To be perfectly honest, I never sought out to be a model. It was something I enjoyed, taking pictures with my friends. I went to school for graphic design, originally for sports journalism. I never thought that I would be doing what I do now. I don't think anyone really thought Instagram would be what it is.
Yeah.
Even a few years ago. So I was getting my second degree in graphic design down in Newport. And, all of a sudden you look around and everyone has work done.
Yeah.
And I was with someone at the time who he pressured me into basically getting breast implants.
So you're dating somebody?
So I was dating somebody where that was something that they suggested that I do.
Oh, wow.
So I admittedly didn't really do it for the right reasons when I look back on it.
Okay.
My second surgery, completely different story. After I had my breast done, I was very happy with the results.
Yeah.
I did feel more confident. I know a lot of people in my life are worried that would then cause, once you fix one thing, you get addicted to fixing all of these things, which I'm sure you have, been confronted with a ton doing what you do.
Yeah.
But when I visited you, it was very much for me. I was with a man that wasn't he wasn't pushing plastic surgery.
All right, but this is kind of key, because I want to back up. Unless you don't want me to, I want to back up, because this is important for women,
absolutely,
and any men out there that might feeling pressure to get plastic surgery. How old were you at the time for your first?
I was 23.
Okay.
Yeah.
And you were dating somebody that suggested you get.
Yes, correct. Okay. And I had been with people prior that also suggested doing it.
Okay.
I've always wanted bigger breasts, but it wasn't like something that was a massive priority to me.
Yeah.
I never thought that I would once again be in a modeling situation.
Okay. So you kind of partially wanted it a little bit more yourself.
I wish that I had just been blessed with it.
Okay.
It was one of those things where I just wished that I had had it.
Yeah.
But then I continuously dated men that wanted me to get that surgery done, including like my first love. So when you hear those things from men, it's like you want to be the dream to anyone that you're in love with. And I think that is something that I wish I could have told younger me, or anyone that is making the decision to go under. You're putting your body through a strenuous procedure, and you have to do it for the right reasons. Obviously, going to someone like you, it's extremely safe to be doing these surgeries.
Right. One of the things I try to do is I try to kind of screen out patients that are there. They're not really there for themselves.
Yes.
And I could be probably getting tricked by some women who are being, coerced by their significant other, that's what they want to do. But I always try to say, is this something that you want? How long have you been thinking about this?
Yes.
You know what I mean?
You're very intuitive. I feel like you can read the room, and I remember those questions.
I don't do that. I like if they're like, honey, what size do you think I should get? I'm like, whoa, I don't really, I don't do that. I don't, because at the end of the day, that needs to come from that person.
Absolutely.
And I don't always catch it probably sometimes, but I think it's important to come from the person. They feel confident about the decision to do something for their body for the right reasons.
Yeah, and if you're a man listening to this or watching this, don't give your girlfriend or wife a breast augmentation or a tummy tuck or something like that for an anniversary gift or a birthday gift for yourself.
Yes.
Do it because she wants it.
Exactly, yes. And I have lots of women that do want these things.
Okay. I love it all.
Especially the tummy tucks. After having kids, are like, oh my God, I've been waiting for this so long.
Yeah.
And the husband's like, okay, finally. Most of the husbands and the boyfriends and the significant others are like, I'm here because I'm here for support.
Exactly.
That's what they're here. And that's the best line I like to hear. So I always get kind of nervous if they're just really kind of leading the whole consultation, and that's always kind of a red flag.
Whatever makes her happy, it is her body.
Yeah. All right. So let's back up. So we had surgery. You went with a surgeon down in Newport, was it?
Yes.
Okay.
He was actually in Long Beach.
We don't have to say names. I don't want to say any names, but Long Beach, and tell us about the surgery and how you felt about it right after.
Honestly, the only reason I went to him was because I knew two different girls that had gotten their breasts done with him, and I was one of those people that it felt familiar to me. They had a good experience with him, so I just said, sign me up. I didn't go through any consultations with anyone else. I was very single focused. I just decided that was the route that I was going to take.
Okay.
I remember the day of surgery, my mom was with me, and we were both frightened by the situation. I think it's, when you rent a room in a different place to do surgery.
Yeah.
And the whole atmosphere, everything about it did not feel safe. And it was one of those things of like, do I go through with this? And I did obviously go through with it. Everything was fine. Healing, there was no issues, no infections. The only problem was it was not an implant that fit my body or that my body could support.
Yeah. It was 450 cc's, high profile. I think
smooth.
It was smooth silicone, right?
Mm-hmm,
okay.
Correct.
Yeah.
Yeah. And I'm very active, and I think I went back to my physical activity and everything like that very, very quickly. I was with that boyfriend at the time where it was kind of like, you've been sitting on your butt, like, let's get to it, you know? And so I think a lot of that messed with the healing process. And that's one thing I really appreciated with you is I felt like I couldn't get it wrong because I was so, you know, not versed, but you educated me on every single step of what I needed to do to be the healthiest that I could possibly be.
Great. Yeah, I mean, it's so funny. We meet about this a lot. We actually met about it today. It's not about just the front part of the process convincing you to get the surgery. It's actually the whole entire process. And I think if you are a plastic surgeon, if you are someone who's going to do a surgery, you have to guide patients from the beginning all the way to the end. You know?
Absolutely.
Either through yourself or in conjunction with your staff, because I have a lot of staff support as well. So what you probably experienced.
Oh yeah,
is good.
Well, I was about to segue into that because it's something I am actually excited about. When people ask me about working with you, the first thing that pops into my head is the atmosphere when you walk into the office. And it's like, I always make that joke of like people celebrate Chick-fil-A employees for the atmosphere that they create because they're always in a good mood and they're so nice to be around.
In and out too.
Yes.
Have you had that feeling too?
Yes, absolutely. Okay. You're so welcome there. And it's kind of like that here.
Yeah.
And every single time I'm like, I leave feeling like I could be friends with every single person that I just met. And for someone that is anxious, I think a lot of us have an anxious mindset, especially when it's something to do with our body. We want to feel very safe. We want to feel comfortable. And I felt like I was in absolutely the best place that I possibly could have been.
This sounds like a big commercial for my practice.
No, but I am serious. Like if you like go through my DMs, you hack my Instagram, this is what I'm saying.
I can't thank you enough for all your referrals and positive support. But to me, it's like, you know, someone's trusting me, my team with their body. You know, you go under anesthesia, you complete trust, right? And it's like, we have to hold that with the most respect. You know, it's just, and I also get you ever been to a doctor's office and there's just like there's like a glass window and they like close it or they open it and they're like this little Scrooge back there. And it's just like, why does it have to be like, it doesn't have to be like that.
No, it's very vulnerable.
I know.
The whole thing's very vulnerable. And the way that you guys run things, you feel like it's a family, which is really nice.
Yeah. Yeah, so that we all get kind of amped when people come in with like positive results and are like, you know, when you show your stuff on Instagram. And by the way, can we share your Instagram?
Oh, yeah, of course.
What is it?
It's always so annoying to have to spell out because it's a really weird username. Yeah. But it's A Katharina V. So it's AKATHARINAV.
Okay. A Katharina V.
Yes.
All right. There it is, you guys. So make sure you follow her and check out what we're talking about. You can see she's gorgeous. She's beautiful inside and out. And so we always love just to see you just kind of really out there being confident with your body. Yeah. And knowing that we were part of that and making that process smooth and easy for you.
Yeah.
All right. So now we had initially. Did you like your surgery? Your first surgery? We're gonna back it up here.
My first surgery, I didn't really have any complaints. That was one thing that has always taken me aback. I think about breast augmentation in general is how much you feel yourself very quickly. I was expecting to be out of commission for a week or two, you know, in so much pain, and then 2-3 days after, it's like, yeah, you're uncomfortable, but then you feel like you can wash the dishes and fold laundry, and you basically have to halt yourself from doing those things because you do feel ready to go back to work on Monday. Yeah. Which is a great thing if you have to, but you also have to really look up for yourself because long-term, the longevity, that's very important. So first surgery was fine. Second was a little bit more difficult strictly because we did the pocket repair.
Right. So let's talk about, so we had some issues with the first surgery.
Yes.
So the issues was we had a high profile implant. So a high profile implant is very narrow and it's very projected.
Yes.
So I typically don't like them because they tend to look fake and they're like little heavy like cannonballs, right?
Oh yeah.
So they don't have a whole lot of weight distribution and they tend to do weird things. They'll bottom out, they'll fall off, they'll fall out of pocket. So people that are thinking about getting high profile implants, I generally convince them not to do it because of the risk of that. Sometimes we get away, you know, but it's just like, it's all about setting up, you know, successful results for people long term. Yeah.
It looked comical, honestly. They were just like, it looked like a hammerhead shark or like headlights or something. It was not good.
They were big for your body too. It's 450. And I also remember you showed me a picture when you were in a bikini, and this is where I think the work stuff comes in. It was just like, I can't show this certain angle.
My entire side, I couldn't show because it had rippled. It looked like a 3 written on the side of my chest, basically. And now I don't have to worry about that. And I think the biggest thing for me is I not only like the way that it looks, it hasn't gotten in the way of doing anything that I like to do. You know, working out, I feel safe working my chest again. And that was something I had to actively avoid. Yeah. And then you feel like this high maintenance person that can't do the things that you want to do because of a plastic surgery decision. It doesn't have to be like that.
Right. Yeah. So, all right. So you came in, we chatted. I saw exactly what you're talking about. And the issue was most likely the implant chosen.
Yeah,
I think.
Absolutely.
I wasn't there for the surgery. I don't know about the pocket dissection or whatever. So we came up with a game plan. One of the things was to downsize you a little bit.
Yeah.
And then switch you to a moderate profile. So which I think was huge. We also switched you to a textured implant.
Yeah.
Which I have right here. I don't know. Have you ever felt one? You felt one.
I felt one in the office. Yeah.
Yeah. And
it's not what you expect.
It's not. Yeah.
It feels like velvet.
Yeah, it's very nice, and this is a smooth implant, and
it's very nice.
Yeah, so given a situation where you have a pocket issue, sometimes, rarely, we'll use a textured implant because it's kind of like it stays a little bit more, and so we made that decision. We did a pocket repair for you, which means we closed off that little gap.
Yeah.
And then we put in a slightly smaller implant, although it was a little bit wider, so we had to kind of rely on that pocket repair, but then we were hoping that would hold up, and it did.
Yeah, which looks more natural, flatter and wider.
Exactly, yeah. So, I mean, your results, they turned out amazing. And tell us about your recovery. You said that you felt that pocket repair on that side.
Oh, I was so swollen. I was like a Michelin man on top for like a week.
Okay.
And then the swelling all went down.
We put you in a specific bra. I think
yes.
And that's another thing is I don't normally use bras, but when I do pocket repairs, I do because it's got to hold it in place.
For sure.
The only problem with that is it holds the swelling up.
Yeah, it was like everything was normal. And then I looked like I gained 20 pounds just in one area.
Yeah.
But it was to be expected. And then I walked around, after doing the removal of the bra, I went back to normal.
Yeah.
So no complaints.
Well, good. And now, since then, how has modeling been?
Great.
Okay.
It actually helped me a ton.
Okay.
No surprise if you saw the before and after.
Yeah.
But it definitely helped. I mean, that's the thing is with modeling, they don't mind you being fake, but you have to pretend that you got there. You have to basically convince the people that it's natural.
Convince who? Like
the consumers, the audience. It's almost like they were just born this perfect.
Yeah.
Which is distorted and it's not a great thing for people.
How do you feel about that? Like,
I don't stand behind it at all.
Okay, all right, cool. Because some women are naturally gifted with large breasts and some women aren't.
Yeah.
And I think for women that are, that want that fuller look, yes, you can get breast augmentation. It's okay. And I'll tell you, a lot of celebrities get that. And that's why if you've seen any of my TikTok videos where I actually call out some plastic surgeon, some celebrities that where I think they might have had plastic surgery.
I think that's important for these young people that are just processing and taking in all of this information. And there is nothing that makes me dislike a celebrity quicker than when they have claimed to never have done Botox or done any of these things. It's like, you're 6 years old. We can tell that you have, and there's nothing wrong with it. You're not any less beautiful just because you have bought some sort of procedure.
Right, exactly. And that's why I love you and what you do is because you're kind of like open about it. You're like, oh yeah, I had breast augmentation.
Yeah.
So I mean, you don't flaunt it and everything, but it's like people ask you, you're open with it. And clearly you're on this podcast talking about it.
Yeah.
So, which I respect and thank you.
Of course. Yeah. If you're a public figure, I feel like there is, you deserve all of the privacy that you want.
Right.
But I think ethically speaking, it is important to disclose things. And I think as a woman, that is important to me because when I know with the comparison thing, I mean, we all do it.
Yeah.
And one of the things that has been the best is the fact that it has become less taboo to be honest about what you have done.
Yeah. And I think that's awesome. I think, celebrities need to go that way. I think they'll be respected by, their fans, their followers more. And what I found is like influencers that are more real. I guess influencers, models, it kind of goes hand in hand now.
Yeah,
it's like,
it does.
It's like, I talked to a friend of mine who's an actress and she's like, whenever I try to get jobs now, they ask like, what's your following? Has that happened to you?
Oh, all the time. It's when I go to castings, it's one of the right under your name.
Yeah. How
many followers do you have? And there's been multiple times that I probably book a job, not because of talent, but because I have more followers.
Right.
And then they can do a tag, you know?
Yeah. So I think when you're open and honest to people and genuine, that you're gonna engage more with your followers, and people are gonna respect you more and follow you more. So I think it's a win-win.
And I think living in a place like LA has made me want to be more real, because you can really pretend to be anything you want to be in a city like this and pretend to have anything that you have. And I don't think that there's anything relatable about that. And I think being relatable and making people feel comfortable with what they have or don't have is like the most attractive quality that one could possibly have.
Yeah. I ride a bike to work.
Just stay fit a little bit.
Yeah. But it's also, it's just like, it's faster.
It's
just like, I don't have to deal with parking. It's just like, I see these plastic surgeons that the first thing they do when they get when they get their first 2 years in or whatever is they buy this like fancy car, Ferrari.
They buy the McLaren or the Lambo.
Yeah. I'm just like, all right, that's super loud and obnoxious. And,
it truly is.
Yeah. And I'm just not into that, to me, I mean, to people that are into cars, great, but it's just like that showy thing where you're trying to pretend, and it's
the why. Once again, like, you can collect cars and love cars, but if you're doing it to get attention, then that's when I lose my interest.
But who really cares about that kind of stuff? I mean,
a lot of people here.
Yeah, I guess so.
Welcome to LA.
It's like, it's just like, do people respect you more because you drive a nicer? I mean, perhaps, I don't know.
Yeah. Priorities are skewed here, unfortunately.
Yeah. Well, good. Well, I want to see. So, I guess we talked about kind of modeling now. What's kind of the next steps for you? What are you kind of getting into, and where do you see your career going?
I would love to get out of modeling. Okay. Truthfully, I don't think that I can feel happy if I stick to a career that relies solely on my looks for much longer.
Right.
I know that I have more to give and more to do, and anything that uses my brain more. I mean, my dream job was to be a criminal profiler for the FBI. That was all I wanted to do. Silence of the Lambs was my favorite movie. I wanted to be Clarice.
Hello, Clarice.
Yeah, it's literally that was the dream to me. But I decided that I want to take a route that isn't as psychologically damaging,
right,
and doesn't make me as vulnerable safety wise. So if I could possibly make this true crime podcast into something bigger, and then that segues into interviewing real law enforcement and. I just want to grow that as much as possible.
It's crazy. My dad was a police officer, and two of my brothers were police officers. And it's just like, sometimes they have these stories that nobody ever knows about. It's really bizarre.
You can't live a normal life.
My dad, when I was growing up, he had like these like knives that he collected from criminals and stuff. And some of these things were just downright scary, like switchblades and little hook knives. And I was like, oh my God, I just remember that back in the day. Like
souvenirs of other criminals.
Yeah, souvenirs of the bad people that he arrested or he was involved with, I guess. I don't know. I never really got, I was just a kid, like, looking into stuff. But it's interesting. I think law enforcement, they're exposed to certain types of people that don't, they don't fall in line with what we typically see in people. And so it's, and I think, unfortunately, they get exposed repetitively to sometimes toxic environments more so, and it affects them as well.
Oh yeah. And the power hunger and things like that.
Yeah. So I think it's fascinating. So, well, good luck.
So
with
do
that.
I. Thank you.
Great. Anything you want to share with the listeners, the followers? Anything we didn't talk about?
Oh man, that's so broad.
I know.
In what category specifically? Just life in general?
Yeah.
I feel like we touched on.
Well, I would say, that, and then also, someone who's thinking about getting plastic surgery. What would be your advice to them? Like, what's your research. What's your decision tree? Okay.
Don't do what I did the first time around, which was ask two girls who you somewhat liked their results, and then just go to that doctor and then be like, this is it, which is unfortunately how I am. I'm single focused. I'm very stubborn. Right. If I've made my mind up, that's just the way it's going to be.
Yeah.
Do your research, really just like shop around. If I had gone to you the first time, I would have chosen you. Right. I mean, you had the best reviews. I had the word of mouth, everything, recommendation wise, referral wise. I don't even remember really how I found you.
Was it through Lauren Everett's Skinny Confidential?
I don't think so.
Oh, okay.
I don't believe so, but it had to have been just your social media presence, something about you. I was just like, I trust this guy. I love his results. They're so natural.
Great.
And look at us now.
Yeah.
I know.
Well, thank you. Thank you for trusting me.
Yeah, of course.
So also we wanted to try and see if we could do a little Q&A. I think, right? So if you have a few minutes, we could do some Q&A.
Let's do it.
All right.
One of the questions that I got when I posted my Q&A thing, a lot of people are so hesitant now because of the breast implant illness discussion, and they wanted to hear about like my experience with it. I have personally not had any negative effects, especially after getting my surgery with you.
Right.
But I'm so curious. I mean, I'm sure that, I don't know if you're sick of talking about that.
I'm not sick of talking about it. I'll talk about it all the time because people, it's something that's out there and I want to educate people on it. And it's very important that people understand the risks of getting, any kind of surgery. When it comes to an implant, implants they're synthetic structures, basically. So if bacteria were to get onto here, bacteria has a great way to form a biofilm. That's why we brush our teeth, is we break down that biofilm all the time to get the bacteria gone, right? So an implant could theoretically get a biofilm on top of it if it's bacterial contamination. So if you ever see my videos on how I do my surgeries, I'm super OCD, how I kind of irrigate the pocket, all that stuff's designed to reduce contamination. Why that's important primarily is for capsular contracture.
Yeah.
That's the number one complication for breast augmentation surgery, and that's when you get that scar tissue that forms around the implant. That's in response to typically a low-level bacterial contamination.
Interesting.
Yeah. So if you do a good job with your implant insertion and all the different stuff, like using the color funnel, all the stuff that I do, your capsular contracture rate goes down.
So it's basically your body fighting a foreign substance and then trying to basically squeeze it out or propel it out, and it can't.
Right? Because it's on an implant. Same thing that happens with like a hip or like a artificial joint. That's why it has to be super clean operation, right? So if you ever see them do like a knee joint or a hip joint, they're wearing spacesuits. You know, they're like super sterile, right?
Phenomenal.
My rooms, they have HEPA filters. And the operating room, I help design it so that it's super clean, and everything we do with the surgery is super clean. Now, what they found with breast implant illness is that there's a certain type of bacteria that actually gets on the implants called propionary acnes. And it's a less common bacteria that can get on there, but when it forms a biofilm on there, for some people, causes their immune system to go haywire. Okay.
Interesting.
This is all what we think we know about it. Okay. There's varying degrees of it. The rate of that happening is way less than regular capsular contraction.
Yeah.
So I'd say maybe 1 in 1,000, 1 in 2,000. And so the treatment for it, simply remove your implants. But things that can happen is like problem sleeping, loss of hair, skin rashes. And I have a lot of patients that come from me with other doctors, and I take out their implants and I do capsulectomies because we've got to remove that scar tissue around there, just clear it out. And then they magically feel much better.
So having the correct doctor that's taking all of the proper steps can help prevent that.
Right, because majority of patients with implants, they're perfectly fine.
Yeah.
It's not like everybody that gets implants gets this. So it's a calculated risk. And so I tell people, it's like, look, if it's a very low risk that that's going to happen to you. If it does, then take them out. So you kind of have to make that decision. It's not like a permanent thing. I don't wish that on anybody. Obviously, nobody wants that to happen, but that's just one of those things that can happen.
I'm always curious if that has something or any sort of complications could be caused by even possibly touching lymph nodes or something like that, such like a delicate area.
I don't mess with the lymph nodes very much. We don't go over there. We stop right here. As soon as I start to see nerves and things like that, I don't go further out there. I try to do a minimal breast augmentation so that I don't mess with the nerve sensation. How is your sensation, by the way?
I don't understand how this is possible.
Yeah.
But I did not have sensation in my previous surgery, and I have like 50% regained feeling now.
Okay.
I don't understand how that is possible.
I don't either.
And I don't know if maybe it's because it was so stretched before.
Because sometimes the nerves, when they get stretched, they stop working, and then if you relieve that stretch a little bit, you get better.
It was like unbearably itchy, I remember at the beginning, and it was, I think, because things were healing. I don't understand how that worked, but all I know is numb before, 50% probably back now.
Amazing.
Yeah, so we'd love to hear it.
So we got a couple questions. We'll just answer a couple questions for you guys.
Yeah.
And these are from some of the people that kind of wrote in. So we'll just get a couple of these in. Let's see. Actually, we answered some of these. What is some of the biggest challenges you faced as a model?
Biggest challenges as a model. I feel like there is, it's like a lifestyle that goes along with being a model. And I think it can get confusing and can get messy where, it's not just going to a photo shoot and then you go home. Not for a lot of people. It's like you start hanging out with models, you get kind of caught up in this like different environment and you get swept up in all of the things that seem very glamorous and exciting, especially when you're young. So I think it's very easy to lose sense of self when you're in this industry and all of a sudden, you're doing these things that you wouldn't normally do and you're in situations that you wouldn't normally be in because you think that that's what it's all part of being a model. And that's one thing that I'm actually proud of throughout my career is keeping that so separate. And I remember hearing very often when I was younger that, please don't let LA change you.
Yeah.
And that was something that I can confidently say that I feel like I am very much the same person that I was 10 years ago. I stayed very true to who I am, but that is not always, you're not always that headstrong in a situation like modeling. It's easy to get swept up.
That's so true. I mean, you got to stay true to your roots. I mean, otherwise you're just lost. Like, who are you?
You have to stand for something, or you're going to fall for literally everything. And I think that's a Katy Perry song, but who cares? It's true.
I think she stole that from somewhere else, though.
Yeah, I'll pretend I said that.
Yeah. And then let's see, we'll just do one more question. Here's another question. What would you say is your biggest accomplishment, just in general?
Honestly, like tied into what we just said, where it's like, I feel like my integrity and my values are very much intact of like what I promised myself. Like I remember, having conversations with my grandpa, having conversations with myself of what I want my life to look like and what I want, if I were to have children, I were to get married, making those people proud and not doing anything that I look back on and regret.
Yeah.
And I feel like I stayed very true to all of those things. And I'm very proud of being, almost 30 years old, living in a place like this, doing a career that I'm doing. And I feel like I can confidently say that I stayed very true to myself.
Amazing. Well, I believe it. Very, very true. All right, Anna Katharina, Katarina V. You guys, you got to follow her on Instagram and definitely give her a shout out. And thanks so much for being on the show.
Yeah, it was so fun. I love this.
We will see you soon for some other things, I'm sure.
Yeah, I'll always come in for something.
Okay.